The topic that we will be discussing today is aneurysms. So the learning objectives of today's session will be, we will see what are aneurysms, what is the definition of aneurysms, what are the different types of aneurysms, and what is the morphology of all various types of aneurysms. Now, what are aneurysms? Aneurysms are defined as a permanent, localized, abnormal dilatation of the blood vessel. So, it is the dilatation of the blood vessel which is permanent. Means it is not reversible. It is a localized dilatation and it is an abnormal dilatation. And this dilatation occurs due to either a congenital or an acquired weakening or destruction of the vessel wall. So whenever there is a weakening of or a destruction of vessel wall, which may be due to any congenital or an acquired cause, it leads to dilatation of blood vessel, which is permanent and abnormal, is called as an aneurysm. Aneurysm generally involve large elastic arteries like the aorta and its major branches. Now, how do we classify aneurysms? Now, there are a lot of factors on which aneurysms are classified. First, depending upon composition of the wall, that is the wall of the aneurysm. According to that, it is divided into two types, true aneurysm and false aneurysm. True aneurysm is when the wall is made up of all the three layers of the normal vessel, but these layers are thinned out. So all the three layers are present, but there is thinning of all these layers. An example, the atherosclerotic, the syphilitic, all the aneurysms that we will be studying today in our class. False aneurysms are those aneurysms whose wall does not contain all the three layers, but the wall is a fibrous wall which is made up of either the outer adventitia, the perivascular tissue, or the blood clot. And this is generally whenever there is a trauma to the vessel, like in an extravascular hematoma, when blood accumulates outside the blood vessel, it is generally a false aneurysm. See in this figure, in the center we have a normal vessel which is lined by the three layers. On the left side we have a true aneurysm where you can see that there is a dilatation of the vessel wall, but the vessel wall has all the three layers of the vessel. So this is a true aneurysm. And on this side we have a false aneurysm. Here this is the dilatation, but you can see that this is more like a hematoma. That is, it is lined only by a outer layer or extravascular connective tissue. It is not made up of all the three layers of the vessel wall. It is just extravasation of blood which looks like an aneurysm, and that is why it is called a false aneurysm or a pseudoaneurysm. Again another picture, you can see these are the true aneurysms and this is a false aneurysm where there is a trauma to the vessel and the blood is seeping out into the extravascular connective tissue. This is the dissecting aneurysm which we will study later. Second classification is depending upon the shape. So according to shape, it can be saccular, it can be fusiform, it can be cylindrical, serpentine, racemose or berry aneurysms, and according to the shape they are called so. If it is spherical, it is a saccular, spindle shape, it's a fusiform, tortuous, it is serpentine. Berry aneurysms are small dilatations which are especially seen around the circle of Willis in the base of the brain in relation to middle cerebral artery. We can have a picture. So this is a spherical saccular aneurysm. This is a spindle fusiform aneurysm. This is a berry aneurysm which you can see around the circle of Willis. Based on pathogenetic mechanisms, aneurysms are classified according to the cause. So if the cause is atherosclerosis, it is an atherosclerotic aneurysm which is the most common type. If it is due to hypertension, then hypertension, syphilis, syphilitic aneurysm seen in the third stage of syphilis, dissecting aneurysm where blood enters into the wall of the vessel and separates or dissects the wall of the vessel, mycotic aneurysms where there is due to any microbial infection, there is weakening of arterial wall and further leading to dilatation. Then it could be due to any diseases like Marfan syndrome, Loeys-Dietz syndrome, Ehlers-Danlos syndrome, in which there are connective tissue disorders leading to weakening of the wall and aneurysm, and others which include trauma, vasculitis, and congenital defects. Based on location, if the aneurysm is located in the abdominal region, it is an abdominal aortic aneurysm. Generally, we see it in atherosclerosis. Most common site is the abdominal aorta. Another is thoracic aortic aneurysm, which is associated with hypertension, syphilis, Marfan syndrome, in which we see aneurysm or dilatation in the thoracic region of aorta. And the third is the aortic